To talk more about this issue, I'm joined now by Dr. Anupam Jena. He's the professor of healthcare policy at Harvard Medical School and a physician in the Department of Medicine at Massachusetts General Hospital. Dr. Jena, welcome to our show. We just heard from our report saying that more than 41,000 cases, dozens of deaths across Europe. Why is this disease more contagious than many others we've seen this year or in the past few years?
This disease is highly contagious, spread by respiratory droplets, and there's a lot of other diseases that are transmitted the same way. I mean, to put those numbers in context, the World Health Organization says there's about 40,000 cases in Europe in this year, and the year's not over yet. That number is considerably higher than what you've seen in the United States. For example, in the last few years in the U.S., we're talking about rates of about 200 cases, confirmed cases of measles a year. And so we're already at 4 times that amount in Europe. If you look just at the United Kingdom alone, there's about 300 cases. And so that's a considerably higher number of cases for a population that's actually quite a bit smaller than the U.S. So this is quite alarming.
So Dr. Jena, do you think a government-enforced vaccination is necessary? And if so, where? In which parts of Europe?
Yeah, I mean, it's difficult because ultimately this comes to a personal choice. I mean, it's hard to force people to take medications that they don't want to take. But this is a particularly interesting example because we're talking about often young kids who could have been vaccinated but weren't vaccinated because their parents thought that it wasn't the right decision. And, you know, that's very, very difficult, I think, is if you look at these kids who then become older and are unvaccinated, they may not even known that they weren't vaccinated. And then they get exposed to the virus unknowingly, and the virus can be deadly, as we just heard. Cases of confirmed deaths in Europe.
So what's preventing many parents and many families from vaccinating their children is the belief that the vaccine is linked to autism. From your perspective, can a causal relationship between this disease and autism be established medically?
So that link has been thoroughly debunked for over a decade now. It remains a concern. There are very vocal advocates of that belief, even though there's no scientific evidence at all to support it. You know, ultimately, this comes down to a conversation between a doctor and a patient. And you know, I suspect there are instances where doctors are unable to have a meaningful conversation with a patient to convince them otherwise. And there may even be some doctors who believe this themselves. But it really is amazing that in this day and age, where we have so many diseases that we don't have cures for, that when we do have an opportunity to prevent a disease, that we're not doing it adequately.
So Dr. Jena, what are the things that measles-infected people should do to stop passing this disease from other people?
Well, it's difficult once someone has it, but you know, the typical course of the disease is that somewhere between 10 to 2 weeks after someone is infected, they'll get a runny nose, watery eyes, quite possibly high fevers, and during that period and the period after is when they're contagious. Now, for most people who get the disease, it stops there and it resolves. But for the unfortunate few, it can progress to infecting and affecting all major organs like the brain, the eyes, the ears, the lungs. The brain and the lungs are where the deaths occur.
Dr. Anupam Jena, thank you for explaining this to us.
Thank you for having me.